From the makers of vet-recommended Greenies dental treats comes an easy way to support your dog's wellness. Greenies Smart Essentials dry food delivers complete balanced nutrition with science-backed recipes. Greenies supplements, developed by a team of PhD animal nutritionists, offers options to help support healthy joints, digestion, and more. Whether it's mealtime or mobility support, Greenies helps you care for your dog from the inside out. Learn more at greenies.com.
This is Veterinary Vertex, a podcast of the AVMA journals. In this episode, we chat about the success rate of vital pulp therapy and factors influencing outcomes with current standards with our guests, Ethan Alezaki and Elias Wolfs.
Welcome, listeners. I'm Editor-in-Chief Lisa Fortier, and I'm joined by Associate Editor Sarah Wright. Ethan and Elias, thank you for taking time out of your busy schedule today to be with us.
Thank you for having us.
Yeah, thank you for having us. We really appreciate the invitation.
Of course. All right, let's dive right in. So, Elias, your JAPMA article reassesses the success rate of vital pulp therapy in dogs and evaluates the impact of patient age and pulp exposure duration on outcomes. Please share with our listeners the background on this article.
Yeah, so the literature on vital pulp therapy was quote unquote a little bit outdated. It has been over 2 decades since the outcome had been evaluated. And so we thought it was the time had come to potentially reevaluate the success rate. And then we also had an extra hypothesis that had not been previously investigated. And we suspected that younger dogs potentially had a better outcome because their apices or the tooth apex is still open. So that has inherently a better blood supply and better regenerative potential. So we wanted to look at that data set as well versus the tooth apex of older dogs that is closed. We thought or hypothesized that they could potentially have a worse outcome.
It's always great to see dentistry manuscripts because everyone needs dental care. And I feel like we don't see that many of them, honestly. So it's really nice to see them in the journal. So thank you for contributing this work.
Yeah, absolutely.
And Ethan, what are the important take-home messages from this JAPMA article?
Yeah, so there's a few. I think one of the biggest takeaways is that vital pulp therapy remains a pretty viable alternative to other endodontic therapies, such as root canal, especially when managing pulp exposure. We found that vital pulp has about an 80% success rate, which aligns pretty well with previous studies. As I said, we hypothesized that younger dogs would have higher vital pulp therapy success rates when compared to dogs. However, we actually didn't find any significant association between patient age and outcome. Lastly, deep pulp dressing intrusion significantly increases odds of vital pulp therapy failure. So it's pretty important when applying the dressing to really carefully and precisely do that in order to decrease any likelihood of failure in the future.
Great take-homes. Elias, you started out by saying, this isn't new, and the literature is a little bit outdated. What really sparked your interest to look at this again? Was it a case or an astute student or somebody asking a question?
Yeah, that's a good question. So first of all, Ethan was or still is a very keen student who wanted to do a research project with us. So we kicked around with a few ideas, and we thought that the time had come to look again at vital pulp therapy, and then with the extra hypothesis of we suspected that younger dogs would have a better outcome. Unfortunately, it turned out for our study that was not necessarily the case. And doing a retrospective study looking at radiographs and at the medical records is a relatively low-hanging fruit. So we thought that would be a good project to do with Ethan, who did the lion's share of all the work from data collection to scientific manuscript writing. So that was a very nice and good experience overall with him.
I'm not surprised. That was kind of a gimme sort of question. I know you know Elias, but for listeners, Ethan is actually one of our student reviewers for JAVMA and AJVR. To our knowledge, we're the only, at least veterinary journal, if not journals in general, that take on student reviewers and actually teach them how to review articles for scientific content, how to provide constructive comments and we give them feedback. It's actually a fantastic program. And Ethan, thanks for being one of our student reviewers.
Sorry. I just want to chime in briefly that as a junior faculty, it's also like my first time taking on a student under my wings and coaching them in this process. And I have to say that working with Ethan has been an absolute breeze, and I couldn't have hoped or wished for a better student to work with. So it has been a really good experience overall. And I really
Fantastic.
like that you guys are also getting students involved from early on in their career. Feel like that earlier on you can coach them and support them. That sets them up for success later on.
Go ahead, Ethan. Tell us about the Student Reviewer Pro's experience.
Yeah, I mean, it's been a really great experience. Dr. Stahl and everyone has really taught me a better way of sort of approaching and evaluating scientific literature. And I feel like I've really taken a lot of, I think it's also really positively impacted, I guess, my research and sort of how I carried out and approach writing and data analysis and the sorts.
Excellent. That's the goal. So it's working. Well, I have you, Ethan. You had a little conversation with Sarah earlier about where some of the take-home messages are, but every time we do an experiment, things surprise us, which then lead to other hypotheses in other studies. What surprised you from the work you did for this article?
Yeah, I think, in our study, we actually found that dogs who received vital pulp therapy more than 24 hours following pulp exposure actually had a greater time to failure, or in other words, it took longer for them to fail when compared to dogs that received vital pulp within 24 hours. Now, this isn't necessarily what we would have expected, as previous studies have shown that basically the earlier vital pulp therapy is performed following exposure, the more likely it is to succeed. Conversely, the longer it takes for vital pulp therapy to be performed, the higher likelihood of it failing. We have attributed this to basically our low sample size. We only had one dog in that category.
So, Ethan, what are the next steps for future research in vital pulp therapy?
Yeah, so mineral trioxide aggregate, or MTA, it's pretty widely regarded as the sort of gold standard for pulp dressing material in both human and veterinary medicine. However, there is a new promising alternative known as biodentine, and it has some pretty favorable properties such as a faster setting time, higher cytocompatibility, meaning it's just sort of safer for cells, and it also lacks this sort of compound called bismuth oxide, which sort of delays setting time and causes discoloration. And so previous human studies have shown that biodentine and MPA achieve pretty comparable success rates in pulp capping and pulpotomy procedures. Notably, biodentine has a pretty superior, I guess, cementum repair, as well as reduced extrusion into surrounding soft tissues. And so we think that this could really promote better healing outcomes. And so biodentine is not pretty commonly used in vet med right now, but it's really a very attractive candidate for future use in veterinary pulp therapy.
Very cool. Sounds like another great project for you and Elias to work on together. So, Elias, AI is everywhere. We're seeing it also pop up in some facets too of veterinary medicine. Do you see a role for AI in this particular area of research?
Yeah, that is a good question, and I think AI is something that, as we all know, has been rapidly evolving. Um, in the long run, I do believe that there will be a place for it. Maybe in taking a bit more of a step back in the broader term of AI, I do think that with machine learning, eventually we could train the computer to assess dental radiographs, which would probably pick up small details better than humans in terms of periodontal as well as endodontal disease that could probably help general practitioners as well as residents, boarded dentists, students. Um, but we need to be careful. And I think we would need hundreds, maybe thousands of cases to be put into the computer. I don't think we're there yet, but in the long run, I do see that I would not be surprised if someone came up with a software that would be commercially available to help guide people with clinical decision making.
Yeah, dental rads can be pretty difficult to interpret. I think we just skip them now and go straight to CT.
Right.
Ethan, as a fourth-year veterinary school, and as we said earlier, a student reviewer for JAVMA and AJVR, how did all your combined training or previous work help prepare you to write this article? And not just write the article, what words of wisdom do you have for people, like how to identify a topic and really get it done while you're in veterinary school?
Yeah, that's a good question. I think for me, my introduction to research really began in my undergrad. I think that really laid the basic foundations, I guess, in understanding, general scientific method, hypothesis testing, and manuscript writing. In vet school, I'm pursuing a DVM, and Wisconsin actually offers a clinician researcher emphasis, and so I'm pursuing that, and it's really helped me to, I guess, integrate research into clinical practice and how to better design and carry out projects. And like you said, I do participate in the JAVMA AJVR student peer review program, and I also participated in Wisconsin's Summer Scouts program. And so they've really helped me, provided me with the tools and really the frameworks, I guess, approach research in a more structured and confident manner. So, um, yeah, I think together those experiences have really, equipped me with, the technical knowledge and the skills that were pretty important in helping develop this project.
Just expand a little bit on what advice you would give to other veterinary students that are looking to get involved in research. How do you get it all done?
Oh yeah, it can be challenging, or a little bit overwhelming with veterinary schedules and classes. For me, I early on identified dentistry as a potential topic or a future career path that I wanted to go into, and I really wanted to pursue further research. So I definitely reached out early on to see if there were any small projects that I could sort of be a part of. And thankfully, Elias had one for me, and I'm really grateful for that. So I encourage any sort of interest just to reach out there, step outside of your comfort zone a little bit.
I did my first project when I was a third-year veterinary student, and I remember it was hard juggling classwork and manuscript writing, and mine was like a prospective study, so organizing the travel and working with all the different teams. Yeah, it was a lot, but kudos to you too, Ethan, for crossing the finish line with this manuscript.
I just wanted to add to that it feels like yesterday that Ethan knocked on my door, and next week he's actually giving a poster session at the American Veterinary Dental Forum with his paper that is published. So that is quite the achievement.
Amazing. Congratulations, Ethan. That's wonderful.
Thank you.
Okay, we want photos too, by the way, so we can put them on social media to show off how awesome our student reviewers are. So this next set of questions is going to be really important for our listeners. You shared really great information today about vital pulp therapy. So we want to share with our listeners now what's the one thing that's really going to change the way that they practice. So Elias, what is one piece of information the veterinarian should know about the success rate of vital pulp therapy in dogs?
Um, it remains a viable treatment for relatively acutely fractured teeth, for which referral to a veterinary dentist is recommended.
Very well said. And then Ethan, on the other side of the relationship, what's one thing clients should know about this topic?
Yeah, I think one important thing is that vital pulp therapy isn't necessarily a one and done treatment. At least in our study, we found that 1 in 5 teeth may eventually fail, sometimes months or even years after the initial procedure. So that's why follow up exams are pretty important. I think it's recommended that rechecks occur every 6 months for the first year or two, and then annually thereafter. Of course, sooner if there's any concerns. And so really keeping up with those visits helps to catch problems early and gives your pet the best chance for long-term success.
1 in 5 doesn't seem to be that bad from what I remember in large animal and horse teeth, at least. I think it's more like 50% end up with some other thing that goes wrong.
Mhm.
Thank you guys again. Always fun to learn more things about dentistry, which I still don't think we learn enough of in veterinary school. As we wind down, we'd like to ask just a little bit of a fun question. So, Elias, if you could have a superpower, what would it be and why?
Yeah, um, another great question. I had to think about it for a second, and eventually I thought about it would be really nice to be able to teleport yourself, because one of the things that lately has been bugging me is the increasingly expensive cost of flying to conferences as well as courses or areas where you can give a talk or a CE event. And on top of that, with missed connections, I do believe it would be really nice to just be able to move from point A to point B in a blink of a second,
I
or a
agree.
blink of an eye, excuse me.
Yeah, and then think of how much more time you'd have for fun, right?
Exactly.
All that commuting time, all that stuff, that would be an amazing not just cost savings, but time.
Mm-hmm. Yep. Cost savings and time.
Yeah.
All of that.
Ethan, Sarah and I have a bit of a hypothesis for the answer to this next question, so I think I know what your answer will be, but, when you complete a puzzle, do you begin with the middle, interior, and complete some form of theme, or do you do the exterior border pieces first?
I tend to start with the border pieces, and I try to work all the way around. But, as I do go, if I come across any, like, middle pieces that sort of seem to fit, like, a pattern or an area, I tend to sort of roughly place them where they might belong. But, yeah, that border definitely gives me a better framework to work with and makes it a little bit more manageable.
Doesn't surprise me, but I would hypothesize that was your answer, and, uh, our assessment so far is that people that tend to do surgery are the exterior border pieces, and purely internists, or educational folks are more the ones that do the, middle interior. Whoever knew you could even start it? My one of my daughters does the middle interior, drives me crazy. I'm like, "Well, you don't have the framework yet."
Yeah, when I read the question, I had also no idea that people would do the interior first. I thought that the framework was something everyone did.
No, it's a fun one. I could say it's every episode, but really do gotta compile those answers. I think it would be interesting. But thank you so much, Ethan and Elias, for being here today and for also sharing your dentistry manuscript too with JAPMA.
Thank you so much.
Yeah, thank you for having us.
And to our listeners, you can read Ethan and Elias's article in JAPMA. I'm Sarah Wright with Lisa Fortier. Be on the lookout for next week's episode, and don't forget to leave us a rating and review on Apple Podcasts or whatever platform you listen to.